Walaikum assalam. Can you listen to my voice?
Yes, I can hear your voice completely. Can you? I'm giving you activation for your webcam.
Okay, I turned it on.
Yes, we can see you clearly. Okay. Can you please introduce yourself and tell us completely a little bit about yourself?
Assalamu alaikum. My name is Syed Hussain. I'm a PhD student at Tehran University of Medical Sciences School of Rehabilitation, and currently I'm in my fifth semester. I'm doing my research under the supervision of Professor Dr. Muhammad Raza Hadian, and right now I'm in Pakistan, and I'm eager to present my systematic review that I conducted a couple of months ago.
Uh, okay. Thank you very much, Ali. I'm going to give you permission to share your screen.
Okay. Let me see if I can do that.
Okay, we can see it, and you can turn on the full screen. So
Yeah, can you see it now?
yes, we can see the PowerPoint, but make it full screen.
Yeah, it's already full screen. Let me do it again if you say. I think it is full screen. Yeah, it's full screen from my side.
I think you need to click the third icon from the bottom. Can you see on your PowerPoint on the bottom right hand side?
Yeah, I know in the
There's
slide.
an icon that's on. Okay.
Yes, I am already in the slide.
Okay. Oh, okay. Then the problem is, did you use the
Oh,
entire screen when you were adding?
no, I used a window, as you mentioned.
Okay. I'm gonna disconnect you again.
Okay.
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 I'm gonna give you permission again.
Okay, full
Click
screen.
the entire.
Okay, I got it
Yeah.
now.
Okay. Thank you. Now make it full screen. Okay. It's done.
Okay. Bismillahirrahmanirrahim.
You can
Assalamu
start.
alaikum. As I mentioned earlier, my name is Syed Hussain and I'm a PhD scholar at School of Rehabilitation Sciences, Tehran University of Medical Sciences, Iran. My supervisor name is Professor Dr. Raza Hadian, and the topic I'm going to present today is my systematic review that has been published recently. And the topic is effect of whole body vibration therapy on spasticity, balance, fine and gross motor functions in patients with spastic cerebral palsy. It is a systematic review of RCTs. Cerebral palsy is a permanent neurological condition which results in pathological tone in the muscles and altered kinesthetic sense. Now, this abnormal tone and afferent information leads to the activity limitation, postural dysfunction, and movement disorders. The main cause of this condition is the damage to the child's brain in the prenatal through neonatal period. Cerebral palsy can be categorized based on the motor disturbances. Mostly about 80% are the spastic cases, then followed by dyskinetic, ataxic, hypertonic, and hypertonic cases. We can also classify it based on the involvement of extremity. For example, it can be monoplegic, hemiplegic, diplegic, and quadriplegic, as well as based on the location of the lesion in the brain. For example, cerebellum, pyramidal tracts, extrapyramidal tract, and cerebral cortex. Whole body vibration therapy is recommended as a novel therapeutic modality in the rehabilitation for the management of static and dynamic balance, functional performance, and gross motor function. Whole body vibration therapy is a neuromuscular training. It's a technique that was primarily used by the elite players to improve their strength and speed. The application of this technique is usually applied in standing position on a vertical oscillating platform that changes the gravitational force on the body and displaces the individual. Now, it induces the tonic vibration reflex via the stimulation of muscle spindle 1A afferents, which causes the excitement of alpha motor neurons, leading to the reflex contraction of the muscles. Whole body vibration therapy has the following parameters, including the frequency, which is measured in hertz, time, which is measured in seconds to minutes, and amplitude is most commonly fixed in most of the modalities and it can be there are two types of stimulators available. From it can be side to side and it can be sinusoidal, so the amplitude can be from side to side as well as from top to bottom. Talking about the eligibility criteria of my systematic review, the selection criteria for the research paper were based on human studies with the PCOS method, where P stands for the population, spastic cerebral palsy, I was for the intervention, whole body vibration therapy, C was for the comparison with conventional physical therapy or the traditional physiotherapy, and outcomes were dynamic balance, spasticity, functional balance, gross and fine motor control functions or hand functions, hand grip strength, balance, and range of motion. And S was the randomized control trial, and we opted for the Pedro score of 4 out of 10. Now, the search strategies, we did an extensive and thorough search on the following databases, including the PubMed, Pedro, and Cochrane. We used the Prisma guidelines to develop our research framework, and the clinical appraisal for the selected studies was based on using the Pedro score. This is the Prisma guideline, and we used it. In the first phase, we identified the potential studies that were available from all the databases, and here you can see from PubMed we were able to find 45 studies, from Pedro 96 and Cochrane 72, and there were none from the registers. So we moved all of these studies, and then we tried to go for duplicate removal, and after duplicate removal, we there were about 118 duplicates. We were left with 95 studies only. Then from the 95 studies, we started the screening, which was the phase 2, and the screening was done by Dr. Rabia and Dr. Numan, which are also part of this publication, and they also screened these studies for, and then we excluded 81 studies, and then there were only 14 studies that were sought for the retrieval. And out of these 14 studies, we selected only 9 studies because the following studies, they have different variables. One, and inappropriate design were 2 studies, and inappropriate age were 1, and unpublished clinical trial was 1. And these are the Pedro scores of the studies that we included. As you can see, most of the studies have a mean score or total score of 8, then followed by 7, and only 2 studies were having the score from the 6. We included the studies from the year 2000 till 2023. So a total of 213 studies were first included or identified, and then based on the inclusion criteria, we removed the duplicates and other strings, and we were only left with the 9 studies. Here we can see the studies that were included. They were from 2020. For example, all were the randomized clinical trials, and the population were cerebral palsy from 5 to 12 years or 8 to 12 years. And similarly, it was these studies included the students or the children of age between 5 to 15 years or maximum 20 years. Then we see for the interventions. The interventions included the whole body vibration therapy. Mostly they were applied in the weight bearing position. There was no study that informed that the whole body vibration therapy was applied in non weight bearing or to any other part, especially upper extremity. All of the studies, they applied the whole body vibration therapy in the standing position and to the lower extremities, like the participants were standing onto the platform. The outcome measures of the studies were the same like we identified before. They were for the mobility, for muscle power, for physical activity, balance, and gross and motor function tests. And similarly, muscle strength was also seen. Time up and go test, 6-minute walk test, all of the variables were already mentioned and they were included. The current study reviewed exposed that in the included studies, heterogeneity also exists in terms of mode of delivery and outcome measures. For example, uh, we see there was a difference in the tools that were selected, but there is a persistent pattern of encouraging the use of whole body vibration therapy and supporting its effectiveness in rehabilitation. The main point of this systematic review is that the evidence has summarized in this regard to the utilization of whole body vibration for improvement of spasticity, balance, gross motor function, gait, and promoting long-term goals of muscle strength in the cerebral palsy children. This review will provide a clear picture for the physiotherapist treating or managing cerebral palsy children to utilize the whole body vibration therapy as an alternative or adjunct therapeutic modality. We concluded that whole body vibration therapy alone or in combination with the conventional physical therapy can reduce spasticity, improve static and dynamic balance, fine and gross motor function in the spastic cerebral palsy children. Hence, it can be considered as a valuable, low cost, and low risk treatment intervention that can be done at home or in the clinical settings. To this point of time, the whole body vibration therapy has been applied to the lower extremities of the patients only. Talking about the limitations of the current review are that only studies that were in English language were selected and unpublished studies or grey literature was not included. Thank you very much. If you have any question, I'm all yours.
Thank you, Syed. Wait for the scientific committee's questions.
Hi. So, if I'm just trying to understand what your study was about. So you selected articles from 2013 to 2023,
From
and
we selected from the year 2000 to 2023.
Okay, so in the period of 23 years, and you tried to look into different uh, projects that was done on vibration
Yes.
of the whole body
Yes.
to treat spasm. Is that correct?
Yes.
Okay, and these are at different frequencies, and these are at different locations of the body.
No. Let me re-clear it because all the studies that I have mentioned, they only applied the whole body vibration therapy to the lower extremities. So the site of application is just the one, that is the lower extremities. Yes, people have used different frequencies, but the frequency range is not. You can say they have divided frequencies into two types. One is called as the low frequency, and the other is called as the high frequency. And it has been established previously that the low frequency is more beneficial in reducing spasticity and decreasing the tone, while the high frequencies are used to promote or increase the tone.
So what is for you? What is low frequency?
Yes, any frequency that is less than 20 hertz is considered to be the low frequency, and more than 20 hertz is considered to be higher frequency, or 25 hertz sometimes is referred to as higher frequency.
Okay, and then at the end, you concluded that this is effective because of the whatever number of literature that you found since 2000.
Yes. Can you see my screen now?
Yeah, I do have it.
Okay, here you can see all of the studies that were included because in the start we started with defining the inclusion criteria of our studies, and we tried to include only the RCTs and those who were talking about the whole body vibration therapy. There was no single study that informed us that whole body vibration therapy has any risk associated with it, or let's say it's not working. So all the studies that are included and that were based on the inclusion criteria, they were in the favor of for the use of whole body vibration therapy in the spastic cerebral palsy.
And how do you check and verify the credibility of the study that you're examining in this review?
Yeah, here you can see, this is the Pedro score that has about 11 items, and they are for different, for example, if there was blindness or randomization, or if there was pre-treatment assessment or post-treatment assessment and things like that. So this Pedro scale is used, and we opted for a minimum score of 4 out of 11. The higher the score, that shows that the quality of the RCT is very good. The lower the score, it means that the quality of the study is not very good. For example, if there is no randomization, or if there is no blindness, or if there is no pre-treatment assessment, and if the the groups are not matched. So that's how it works. And the Pedro score is used most commonly in the systematic reviews.
And you've done that for all of the studies that
Yes. In on my screen you can see this. This is the table that shows the scores. And unfortunately, I did not mention the questions over here because of the space. Otherwise, I can share the Pedro score in the group if you like.
Oh, that's fine. All right, thank you. I don't have any further questions.
Thank you.
So, okay, thank you, Ali. Thank you for your presentation.
Thank you very much.
Disconnect now.
Khuda Hafiz.
Khuda Hafiz.